Welcome back. My next guest is Dr. Mary Beth Baylon, who is a gynecologist with Baptist Health Lexington. Welcome.
Thank you.
Now, I said at the start we're going to talk a little bit about birth control pill, or I said birth control pills, but there's a lot of methods of birth control, and they're not all the pill.
Correct.
Tell me about some different ones.
So kind of the way I will normally counsel my patients is kind of from most effective to least effective. So a lot of the newer medications are more effective. You'll hear them called LARCs, or long-acting reversible contraception. The usual ones that I'll kind of go over first are the intrauterine devices, an implant that goes in the arm, and then the injection called Depo-Provera.
You say intrauterine devices, that actually goes into the uterus as an office procedure?
Correct, yes, we do them in the office. It is an intrauterine device. There's two types. There's a progesterone-based one, which acts locally on the lining of the uterus, and then there's a copper intrauterine device.
And who's a candidate for that?
So overall, for all IUDs or intrauterine devices, pretty much anyone is a candidate. With the copper IUD, obviously, if you had an allergy to copper, would not be the best option. And then sometimes in women that haven't had babies before, it's not contraindicated. Sometimes it can be more difficult for them to have the idea of having that exam done. But overall, given that it's a local hormonal effect for the progesterone-based ones, pretty much anyone is a candidate for it.
Now, you mentioned babies. You can start that at any age. I mean,
correct,
for birth control.
Yeah, and I am a huge advocate for the long-acting reversal contraception in teenage populations, young reproductive age women, because it's an excellent form of contraception. It usually helps their bleeding to be lighter, potentially less painful, and then it's also very reliable. They're not having to remember to take a pill every day.
And how long does the IUD, intrauterine device, last?
So the intrauterine device, the progesterone-based, which is your more common one, can last up to 5 years. There are some newer ones on the market that are 3 years, but the standard one that came out first is 5 years.
You also mentioned an implantable one. They put it under the skin, in the arm or leg. Where do you do that?
Yeah, so that's a subdermal implant, so just under the skin. We usually put it on the non-dominant arm, kind of around this area, and that lasts up to 3 years.
And does that have hormone base in it also?
Correct, it's progesterone based as well.
And how long does that last?
That one lasts for 3 years.
And anybody is a candidate for that also?
Yes.
And simple to do, office procedure?
Yes, it's a very simple office procedure and also very simple to remove.
And you remove it in 3 years and you can replace it with another one?
Correct.
Okay. Now you mentioned an injection also.
Yeah, Depo-Provera, so that's also progesterone-based hormone contraception. You can get that injection in most gynecology offices, and that's every 3 months that you would return for that injection.
And are there any risks to any of these procedures?
I mean, your typical kind of simple procedure, bleeding and infection, those risks are way less than 1%. Other than that, there's some few contraindications to some of them, but for a lot of people, these methods are a lot better because you don't have the estrogen component, which can cause your clotting risk for some people.
Okay, you mentioned clotting risk. That's one of the risks with the birth control pill, but there are a lot of pills out there, and a lot of people still take them.
Correct. Yes. So far from people that wouldn't be a candidate for what most people would just call your run-of-the-mill birth control pill that has estrogen and progesterone. Women that are 35 that smoke more than 15 cigarettes a day, if you have a history of a blood clot or currently have a blood clot, those are kind of the contraindications to using the pills.
Okay. There are also the barrier methods.
Correct, yes. And that's kind of usually I'll start with those long-acting reversible, use the pills, the patch, and the NuvaRing as well, and then barrier methods such as condoms, female condoms, spermicides. Those are still effective forms of birth control, just not as effective as the ones that we talked about first.
They'll use birth control to prevent pregnancy, but birth control pill doesn't prevent STDs.
Correct, and that's a very good point. Usually, especially in all of my younger reproductive age women, always asking if they're using condoms, and then recommending routine screening for sexually transmitted infections, especially in those early 20s and teenage years.
Okay, now we talked about these are all, I think you used the term reversible. What's not reversible?
So permanent forms of sterilization, that we would call it, or permanent forms of birth control, the one to not forget about is a vasectomy for the male partner. And that's a lot of times one that people will forget. And then from the female standpoint is getting your tubes tied, as most people would say. And that can be done a number of different ways. It can be done at the time of a cesarean section or a C-section. It can be done after a vaginal delivery through a small incision, or we can do it laparoscopically with small incisions with the laparoscope, pretty much at any time.
Well, that's great information. Thanks for coming
Yeah.
in. And now